Thank you, Dr. Fuster. This is indeed uh, a very complicated case, but you can start seeing that the pulmonary artery is dilated on the CT, and you can start seeing a start of an embolism in the right pulmonary artery and here in the left pulmonary artery. As you follow along, you can see the lower lobe vessels are completely clogged. There's hardly any dye going across. So essentially, there's very little perfusion going down there. And if you look at the bottom of the screen on the left side of the screen, on the right lung and the periphery, you probably start seeing some start of infarcts there. If you remember, this used to be on the old x-rays called the Hampton sign, some equivalent of that. There are some blood vessels flowing to the anterior part of the lung, probably going up to the upper lobes. At this stage, I would hazard a guess that is what is keeping her perfusion to the lungs going. The remaining part of the lung is hardly perfused. These are not lung windows, so we can't exactly be sure, but that's how it seems to be. As we keep going, you start to see a big right heart, both the RA and RV. And as Julia had pointed out in the echo, the septum is bowed to the left, suggesting that the pressure in the right heart is exceeding the pressure in the left heart. And on the echo, we already saw that this happens both in systole and diastole. So that is a significant elevation of pressure on the right side. And the right heart is not used to taking high pressure. So it's following the consequence, and the right heart seems to have failed here. So it's a tricky situation here. Signs of a major pulmonary embolism clogging both the main pulmonary artery branches.